My name is Hilary Rankin. I'm a consultant clinical psychologist and the clinical lead for COPE. And COPE, as you can see, stands for the Centre of Pain Education. We're a small multidisciplinary service based at Sutton Hospital, and we run a pain management programme for people with chronic pain. And here's our team. As you can see, there are 5 of us, a dedicated administrator and 4 clinicians, all working part-time with the service. There are 2 clinical psychologists, a physiotherapist and a nurse specialist, all specialists in understanding and managing chronic pain. Before I talk about the work of COPE, I'd like to put it in context by telling you a little bit about chronic pain. We know that around 13% of the UK population live with chronic pain. In other words, they have pain most of the day, on most days, for at least 6 months. And unfortunately, medical and surgical treatments often don't work as well as we would like. So many people cope very well with living with chronic pain, but a significant proportion of people become increasingly depressed and disabled over time as they struggle to cope with their pain. Pain affects all areas of people's lives. So the people we see at COPE, many have stopped work because of pain, or they are struggling to continue with work, perhaps with frequent sick days off. Pretty much everybody we see will either have stopped or reduced their daily activities, to the extent that sometimes even something that would be easy for most of us, like walking to the corner shop or hanging the laundry out, can become difficult and can worsen their pain. In the struggle to cope with their pain, often leisure activities go out the window completely, and social and family relationships are affected too. And one of the hardest things people tell us is that because their pain is invisible, that they feel often disbelieved and misunderstood by many people, including family, friends, work colleagues and health professionals too. So it's perhaps not surprising that many people can become depressed about their situation and fearful of what the future holds. So our aims really are to try and reverse this downward spiral for the people that come to our service. Everything we do is underpinned by the principles of cognitive behaviour therapy, but not just delivered by the psychologist, but by the nurse and the physiotherapist as well. And that, combined with our understanding of how pain works in the body, can help us to help people understand their pain better and give them different coping strategies. And as a result of that, we're able to help people reduce the suffering that so often accompanies chronic pain, to improve their physical function, and most importantly, helping people get back to the things that make life meaningful, whether it's work, social and leisure activities, or improving relationships. We also find that many people have had a long, hard struggle of desperately trying to find a cure for their pain. And one of the things that's very hard is accepting that you have to live with a certain degree of pain. But we find very often it's a relief for people when they actually give up that struggle and find that they can make a better life for themselves despite their pain. We know that there's a lot of people living with chronic pain, and not everyone will need or want a pain management programme. But our patients consistently tell us that not enough health professionals are aware of our service, and that they should be offered it as a positive choice earlier on in the course of their pain, not just as a last-ditch, end-of-the-road treatment when everything else has failed. We would like to see that happen, but we can't make that happen alone. So in other words, we believe that coping with chronic pain is not just a COPE issue, and we would like to be working very closely with everybody delivering healthcare in order to improve outcomes for people with chronic pain. So on that note, I would like to introduce Stuart Rogers. Stuart Rogers is somebody who lives with chronic pain, and we are extremely grateful to Stuart because he's kindly volunteered to come and tell us about his experience of being referred to COPE. So thank you, Stuart.
Thank you, Hilary. Good evening. My name's Stuart. I'm 39 and I run my own business as an IT consultant living in Sutton, trying to run a business at the moment. I was invited to talk to you about my experience of attending the COPE pain management course. But first allow me to give you a brief background to demonstrate why I needed COPE in the first place. I've been a type 1 insulin-dependent diabetic for, 20 odd years, since I was 18. And due to diabetic complications, I suffer from chronic renal failure, of which I'm currently waiting for a kidney and pancreas transplant. Nerve damage due to diabetic neuropathy, osteoporosis, which causes my feet to randomly fracture, diabetic retinopathy, which has left me partially sighted, anemia, and arthritis. All of these cause pain. Pain affected every part of my life, and in particular my family. I tried every painkiller that I could take, but because of the kidney failure, I could only take a limited selection of medication that, to be honest, didn't really help. Then, during one of my checkups with one of my doctors, he told me about the Centre of Pain Education course and asked if I'd like to apply. I was willing to try just about anything at the time, so I said yes. I had a friendly interview with 3 members of the clinical team to see if the course would be of benefit to me, and they agreed that they could help. I attended COPE's introduction meeting and decided I'd like to apply for the course. On the first day, we were introduced to all of the clinical team, who discussed the itinerary of the course and what we planned to achieve by completing it. We also got the chance to meet our fellow attendees and find out why they were attending COPE. I soon found out that I was not the only person living with pain, and was interested in hearing how other people manage to cope in their day-to-day lives. The course allowed us to examine the many facets of pain and what we can do to minimise its effects both mentally and physically. We learn, for example, what pain is, how pain works in the body, how fitness can help, what sort of exercises would help our manoeuvrability, how to relax, can be very useful tonight, even how to create your own pain management pack that could help us whenever pain flares up in the future. Most importantly though, we examined what we valued in our lives that pain was preventing us from doing. We then discussed setting goals that, if achieved, would enable us to enjoy the activities that we are currently unable to do. I knew I needed to start exercising, but the fractures in my feet were not allowing me to do most of the popular forms of exercising. After some discussions with Hilary and the rest of the clinical team, we all set goals that would hopefully lead us to achieving what we valued the most. One of my most important values that was set was to get fit enough to spend more time with my family doing physical activities that I thought we were missing out on. It was suggested by the COPE team that maybe I could try swimming. That way I could do my exercise and have some fun with my 3-year-old son at the same time. We set the huge goal of swimming half a length of the pool. That way I could spend some time splashing around with my son afterwards. The first swim was completely exhausting, but I had a fantastic time playing in the pool with my son, where we actually laughed together for the first time in about a year. The clinical team helped to motivate me to gently increase my swimming distance each week. And each time I proudly reported back to the clinical team and my fellow COPE students that I managed to hit the target for that week. After 8 sessions, the COPE course finished and we all left with a clear plan of what we needed to do in order to manage our pain. For me, the results were outstanding. I really got the fitness bug, and I now swim, when I'm not in this thing, 1 kilometre 3 times a week, and I'd normally do weight training on those alternate days. But my son comes along as often as he can, which is most of the time, and more often than not, I end up spending about 2 hours playing in the children's pool with him. I'm fitter than I think I've ever been, apart from this, and COPE has given me something more than pain relief. They've given me my family back. My pain is still there, but I now have the ability to cope with it when I need to. In fact, my family life improved so much that we now have a new addition to the family, and as you can see, he joins in as well. Just don't look at the bloke in the middle. I don't know who he is. Thank you very much.